So the Centre for Nursing and Midwifery Research is a collaborative project between Western Sydney University and also the Nepean Blue Mountains Local Health District. Our role is really just to foster and mentor any interested researchers and provide them some foundation so they can come and work with us in the centre if they have any research questions or if they want to pursue research in their nursing or midwifery careers.
There's two different ways that the centre has supported me and will support nurses and midwives overall with projects that you're doing as part of your role, but there's also the secondment opportunities that I would really encourage staff, nurses and midwives to take advantage of.
Being at the centre allowed time for focus completely on the project without interruptions, and I was able to really search the literature extensively and really feel across the topic.
There are research institutes usually located on a university site, but there's not many centres that are actually located on a site like at the hospital. It's about that collaboration, I think, to have those conversations with those clinicians on the ground.
You're able to stay connected, they're really, really supportive, they're very patient, they know that we have a lot of other competing priorities as clinicians, but they keep the door open. For me, every time I head back there and we sit down around the table and have a discussion about the project, I always leave feeling really energised and inspired to get back onto it.
I guess their incentives are that they're encroaching into another trajectory in their career. It's developing those extra skills as a researcher, not just a clinician.
I think midwives should engage in research because they have the opportunity to ask the women at the time about what can make a difference for them. And then it gives us the power to actually implement what the women want.
You know, while nurses doing that frontline work with patients, you're really able to make a huge difference to their lives, and it's a very satisfying career. But by doing research, you're actually able to make a difference in patients' lives on a systems level.
It has a direct link to that practical component of hands-on nursing, I think.
We can't do best practice unless we have the research there.
The centre has actually provided me with that support of really understanding how to do a project from go to woe, everything in between.
This has actually opened up doors for me. Through this, I've actually become an adjunct fellow through Western Sydney University because they've recognised that I can have an impact.
It provides a really good culture, I think, just in terms of asking questions and improving our practice and what we do and understanding why we do what we do.
The key thing about research is that you as an individual can make a difference worldwide, and that is so important.